know when to go out, know when to stay in.
Good afternoon, everyone. Like I said, I'm Dr. Khaled. Welcome to this webinar focusing on carers. Being a carer can be a rewarding experience, but sometimes it can be quite challenging for carers to take care of their own well-being. This can have an impact on all aspects of their life, including health, relationship, finance, and work. Carers without having proper information and support can experience quite a lot of difficulties. As some of you might be aware that it's a Carers Week, we at Firstcare Practice would like to support and reach out to our patients who are carers. We would like to provide information and support needed to look after their well-being. Today, we are privileged to have with us Mr. Michael Shan, Head of Membership and Volunteering Carer UK. He will enlighten us and share some information on carer support available in the community. At the end of the webinar, you will be given the opportunity to ask questions. So please write down your questions using the Q&A box. During the webinar, there might be some technical issues that we might experience. We'll try to get them fixed promptly, so kindly bear with us in case there are any issues. Also, at the end, we will also launch a poll to get the feedback on this webinar. Kindly take part in this poll as it will help us improve for future webinars. Okay, so over to you, Michael.
Hello there, everyone, and really nice to, well, I can't see you all, but nice to meet you all, and happy Carers Week. So this is the first day of Carers Week, which is our annual campaign to raise awareness of caring and to celebrate carers and to recognise all that you do. We know that caring can be really tough at times, and especially in these unsettling times as well. We know many carers are experiencing additional challenges in their roles, and because of the lockdown as well, are some carers we know are feeling kind of isolated and lonely as well, and having to spend more time in their caring as well because of, for example, opportunities for respite, for taking breaks are not there at the moment, and perhaps paid care workers that would have been coming to help you in the home may not be able to come in as well. So I'm going to do a short talk on a little introduction to caring, to Carers UK, and a little about Carers Week and what's available during Carers Week. So I'm going to share the screen now, so I can just show you a few presentation slides while I'm talking. So just you can see that okay, Nadia?
Yes, absolutely fine.
Okay, great. So it's time to talk about caring. So first of all, a little about who is a carer. So Carers UK define a carer as someone who supports a loved one who is older, disabled, or seriously ill. And a carer can be absolutely anyone. It can be a parent, it could be, say, a parent with dementia, it could be a wife or a husband or partner who's going through, has a serious medical condition, for example, or long-term condition. It could be a daughter or son, or other family member, or it could well be a friend or a neighbour as well. So I've got some stats in a minute on who is a carer. Normally at this time, if it was a face-to-face discussion, I'd be kind of asking you a little about, who seeing that definition, who is a carer, but hopefully we'll get to talk about that a little later. So a little quiz now. I mean, I know you won't be able to call out at the moment, but I've got a little quiz. So just for you to think of how many unpaid carers there are in the UK. And people usually underestimate this. We, in the last census, were 6.5 million carers in the UK. we estimate that's increased to 8.8 million. And today, we've just released some, or as part of Carers Week is organised by several charities, and from some research that we've just done, we estimate that as a result of the coronavirus crisis, the number of carers in the UK has increased by another 4.5 million over the past 3 months. So it's increased to 13.6 million. So this, I think we were really surprised by that stat, it's increasing so quickly. And I think when the crisis is over, that we could well see that coming back down again. But yes, really recognising how many people are having to dedicate time to looking after their loved ones. How many carers a day give up work care? So we have a lot of our members that we know talk to us who sometimes have had to give up work very suddenly to look after a loved one. And from our research, we estimate that 600 people per day are giving up work to care. And lots of our work, we do try and support carers who are working to remain in employment as much as they can. And for example, through applying for flexible working, going part-time perhaps. And then what's the economic value of the combined support that unpaid carers provide every year? So this was some research that we've done a couple of times. We've updated it, and it's due to be updated again, so it's going to be higher than this. But we estimate that the value that you and other carers around the country, in terms of if the state had to pay for people to do what you do, it would cost £132 billion per year, which is nearly the cost of another NHS. So a huge contribution that you make to our society, that simply I think we couldn't afford to provide if you didn't do it. And by what age do you have a 50-50 chance of being a carer? This was some research that we did for Carers Week. I think it was Carers Rights Day last year. We estimate that average age for women is 46 when you've a 50-50 chance of being a carer, and for 57, the age of 57 for men. And we estimate that 65% of adults will be carers at some point in their lives. So 2/3 of us will be a carer at some point in our lives. Just picking out a couple of stats, this again from Carers Week last year, that stat at the bottom, 35% of unpaid carers say that they are often or always lonely. So that's 7 times the rate of the average UK population. And I think one of the stats I find really quite sad really is that when you ask carers about what they feel about are things worthwhile, what they do in their life is worthwhile, carers are 1/3 less likely to say that what they do in their lives is worthwhile, even though we know that looking after someone who is older or seriously ill or has a long-term condition is an incredible task that you do often over many years, and often your own mental and physical health can suffer as well. And then carers are also nearly twice as likely to feel anxious as the general population, which perhaps not so surprising given the stresses that carers often experience, often not just being concerned about the person you're looking after and your own health, but often financial worries as well. There we go. So yeah, just another quick stat on working carers. So 3 million carers combine paid work with care. So that's 1 in 9 in any workplace, which I think is another striking stat. So whenever we give talks to organisations that that if you see 100 people in the in the audience, then it's likely 1 in 9 of them will be a carer. A little on Carers UK. So Carers UK was started by a remarkable woman called Mary Webster in 1965. Mary was looking after her 2 elderly parents and really struggling and thinking, there must be other people out there who are going through similar things to me. And Mary wrote a letter to the Times, and of course that was way before email, and she put her address at the bottom of the letter and got something like 3,000 letters coming back saying, yes, I'm going through this. And at that time it was pretty much all women, and in its early years Carers UK was an organisation for women carers. Now it is for all carers, and we know that I think something like 35% of carers are men. And we have over 30,000 members, over 500 volunteers, over 300 affiliate organisations, and 150 employers for carers organisations. These are employers who recognise the carers within their workforce and want to put in place the support and policies to support those carers who work for them. And our vision is a society that respects, values and supports carers. And if I was stood in front of you in an audience, I usually say, where do you think we are as a society on a scale of 1 to 10 in respecting, valuing and supporting carers? Because it does feel that is an achievable vision. We should be able to do that. But, when you ask carers, most people don't give it much more than a 5. Sometimes it's a 3. I think the highest I've had is a 7. So we've a long way to go still, but it does feel that's achievable. And we know that I've been at Carers UK for 8.5 years now, and it does feel things have changed. There is more awareness of carers now, I think, within health and social care plans and strategies. That when I first started, our volunteers were having to stand up and say, remember the carers, there's no mention of carers in here, whereas there is now. And I think there's much more recognition of carers, even though, as I'm sure some of you would say, that the support for carers and the level of benefits is we've a long way to go still. In terms of what we do, we provide information, advice and support. So we have lots of information on our website, which is carersuk.org. We have a helpline where you can phone up or email to get advice on your specific situation, and we have lots of printed resources, leaflets as well for you as well. We also do a lot of campaigning and research to bring about change for carers. So the research I just mentioned that we've launched today, and we also did some research in March into the impact of the coronavirus on carers, and produced a report in April called Caring Behind Closed Doors. And that was where we found out that carers are spending a significantly more time in their caring roles than they were before the coronavirus crisis. We innovate as well, so we provide support to carers through, for example, we have a Jointly app that you can download to put on your mobile phone, and that connects you with other people, say within your family and friends and neighbours, who might be all playing a role in looking after the person you look after. So everyone within that circle then would be aware of when someone's hospital appointments are, what medication they need to take, and how often. So for example, if you were ill or got taken to hospital, the other people within that network will be able to step in and help you out. And then we also have an online community called the Forum, as well, where you can connect with other carers who could be living anywhere in the UK, but will understand what you're going through. They're all carers or former carers, and are there to kind of provide that emotional support and practical tips as well on your caring. And really encourage you, if you're not already a member of Carers UK, to join up. So membership's free. It only takes a few minutes from our homepage, carersuk.org, and you'll see in the top right corner there's a join button, or there's the link there on the screen. So when you join, you receive our quarterly caring magazine, which is really popular. We'll send you monthly email updates if you're on email. You'll be able to, anyone can look at our forum just by going to the homepage and clicking on it, but you'll be able to access the member only sections, and you'll be able to post on it when you remember. You'll also get invited to events. At the moment it's online events, but we do events around the country. So normally in Carers Week we'd be out giving talks, and our volunteers will be out at lots of events and giving talks as well. And we'll have an annual conference, which is for the past 10 years has been held in London. We're hoping to hold some kind of conference this year, but likely to be online, and we'll be in touch with our members quite soon on that. And you can also take part in our campaigns to raise awareness of caring, to bring about change, such as improved carers allowance, things like that, and to get involved as a volunteer as well. So as I said, we have over 500 volunteers who are out there raising awareness of carers and connecting them with the support they need. And we often hear from carers who struggle along for years and years, and then might have a chance encounter with one of our volunteers, and puts them in touch with support, and that can make such a difference to their life. So this was the report I mentioned, Caring Behind Closed Doors. So we know that it's been a really tough time the last few months for many carers, and so we found 70% of carers providing more care than before. 55% said they were feeling overwhelmed and worried about burning out as well, so 1 in 2. And as part of this report, Carers UK is calling for an increase in carers allowance, sufficient personal protective equipment for unpaid carers, and increased awareness and recognition of carers. And we know that many carers have found it difficult, for example, to get into the priority slots for shopping at supermarkets, and having to, unless they don't receive carers allowance, trying to prove that you're a carer can be quite difficult. We've also developed, are developing, it's being updated week by week, some comprehensive information for carers on coronavirus, and so to try and address all your concerns. So from the concerns that carers have been sending to us through the helpline, through our online forum as well. So we've tried to respond to all the issues, and of course, as the government's guidance changes as well, we're updating the guidance all the time. So I really encourage you to go and have a look through those pages. Our helpline as well is open from 9 till 6 p.m. from Monday to Friday. So please do get in touch with them if you'd like specific advice. So on to Carers Week. So yeah, this is our annual campaign to raise awareness of caring, highlight the challenges unpaid carers face, and recognise the contribution that you make to families and communities throughout the UK. So, and this year the theme is Make Caring Visible. So really encourage you to go onto the Carers Week website there, and it only takes a minute or so at most, I think, to you can add your voice to the campaign to make caring visible. I think we've got about 1,500 people who've added their voice. You can also make a pledge if you want to make a personal pledge for what you're going to do to raise awareness as well. And then just to let you know, we've got to see, in response to the coronavirus crisis, while we've all been working at home, so we're not a huge charity. We've got about 50 staff across the UK, and of course we've all been working from home for the past 3 months. But in some ways, it's been, I think, as with many organisations, it's made us do things differently and discover things for connecting with carers that have worked really well, and I think will probably continue beyond the coronavirus pandemic. And so one of these is our Care for a Cuppa online meetups. So this is just like on here on Zoom, except that you can all chat away. It's not just one person presenting to you. It's for everyone to come and talk about how you're feeling, connect with other carers, and and they've been really fantastic sessions. Sometimes carers really sharing what they've been struggling with, and more experienced carers providing a few practical tips. Other times we've had quite a laugh about quite a few things, and carers have said that, I remember one woman saying that it was just a chance in the week to have a break and let her guard down after holding it together all week in her caring role, just a chance to connect with other carers who know what she's going through. So for the past kind of month or so, and we'll continue this after this week, we've been running the Care for a Cuppa sessions every Monday afternoon at 3, and also share and learn sessions where we invite an external guest, as Nadia has done with me today. So we've had sessions on creative writing session and music session, with a couple of sessions on well-being. But this week we've got the Care for a Cuppa chats every day at 3 o'clock. This afternoon's is really full. We've got about 50 people coming, so I'd maybe suggest not coming to this one. And also the chat on Thursday, I think, is booked up as well, with an author who's written a book about caring. But Tuesday, Wednesday and Friday we've got slots available if you'd like to join us. And we've also, tomorrow we've got a session on keeping fit with someone from Sport England. So really welcome you to join us on there. I just realised I haven't got the link there, but yes, if I just tell you the link to register on there, it's carersuk.org, then /Cuppa, CUPPA. So carersuk.org /Cuppa. And then also during the week, we've got 4 question and answer sessions with our helpline advisors. So these are experts in all aspects of carers' benefits, social care, so they would usually be on the helpline, but they're running live sessions from 11 till 12:30 every day. So there's one going on right now on carers' allowance, and tomorrow we've got one on care and support in the community, one on Wednesday on disability benefits, and one on Friday on maximising income when you're over the state pension age. So if you go to the Carers UK forum, you'll need to join as a member to be able to post comments in there. But yes, we'd really welcome you coming to those sessions as well. And there we go. Thank you very much, everyone, for listening. So happy to answer any questions, or try to answer them anyway. Right, so I need to stop sharing, don't I?
Thank you so much, Michael. That was really useful information, and I'm sure our patients found it quite beneficial. We will open to question and answer. We've got one question here. So we've got a patient asking, is every carer eligible for carer's allowance? At present, how much is the carer allowance?
Right. No, unfortunately not. So the carer's allowance at the moment, there are several conditions that you need to pass to be eligible for carers allowance, so you would need to have a carers assessment sometimes they're run by the local authority, sometimes by a local carers organisation. So I'm not sure in Hounslow who would undertake the carers assessment. So on Carers UK's website, in the help and advice section, there is a local directory, and if you go in there and put in, I think put in your postcode or just you could put in Hounslow, and they'll let you know which are your local carers services, and they'll be able to tell you how to go about getting a carers assessment. Carers allowance, you need to be a full-time carer really, so you need to be caring for more than 35 hours a week, and not have a household income more than around, I think it's around £15,000, something like that. And the level of carers allowance, I can't remember exactly, but it's about £65 a week, so it's not great at all. And I think it's one of the lowest of the benefits. So we've had an ongoing campaign to raise awareness of to increase carers allowance, and in Scotland, the government there has given carers a carers allowance supplement, which has been increased further during the coronavirus crisis.
So we've got another question. What support do a carer get in case he is sick? So I think what they're trying to ask is, what support do a carer get in case the carer gets sick?
Gosh, that's a good question, and I suppose it depends. And there'll be the informal support of family and friends, but yes, that's often a concern of carers, and there is sometimes in some local authorities as well, they have a card that carers can carry around with them that has the key details that says that they are a carer, and will have key details about the person that they're looking after. So, for example, if they were suddenly sick away from the home and it was an emergency and they had to be taken to hospital, say, that people could identify that, yes, they're a carer and they've got someone at home who needs that support. But in terms of support, so say if you had developed a long-term condition that was going to make it very difficult for you to continue in your caring role, again, I would encourage you to organise a carer's assessment, and even if you've had a carer's assessment, to try and get another one to say that your circumstances have changed, and that might mean that you could access some additional support. But with that kind of question, I'd really encourage you to contact our advice line as well about your particular circumstances. So if you have particular concerns around your own situation. And the other thing you could do, of course, as I mentioned, is to go on one of the Q&A sessions with our helpline advisors. So I'm not an expert on carers' rights and benefits, but we do have those experts within the organisation. The other thing I would say is that if you go onto the Carers Week website, which is carersweek.org as well, you can find out what other events are taking place in your local area as well. So I know with the online, these kind of Zoom type webinars, you could log on to anyone's if they've got an online event for carers, and but it might be interesting particularly to connect with carers in your local area. So if you go on to the Carers Week website, you can find out what events are available to you in Hounslow.
Thank you so much, and thank you so much, Michael, for taking your time out and carrying out this webinar.
I just wish I could see you all and meet you all in person, and have a chat over a coffee now. But never mind. And I will be very happy next year, hopefully when we're through this, to maybe come locally to Hounslow and run a session there. But thanks very much for listening, and wish you all well, most importantly during these times. But hope you have a good Carers Week as well.
Thank you.
Thank you. Bye.